to the Vision Quest video series, Step-by-Step Guide to Holistic Health. This series is comprised of 40 programs, each addressing a specialized area of holistic health. In this program, we will explore traditional Chinese medicine. Roger Yunke, doctor of traditional Chinese medicine. And my background is that I always wanted to be a doctor since I was a little child, since my father passed away when I was quite young. And in college I went to pre-med and got a job in a hospital and everything, and I realized very quickly that that was not what I thought medicine was going to be or should be. And therefore I became a student of the world's original cultures, literature systems, I guess you would call it, the poetry, the dramas, etc. And interestingly enough, in primitive cultures, I found the kind of ideals of healing that I thought had maybe been lost here in the Western world. So I pursued traditional Chinese medicine, been to China 5 times, really amazing experience. China, very far away, philosophically as well as in miles. And I have had the wonderful privilege of being the director of a clinic for many years and being a consultant for numerous hospitals and HMOs, as there is a very fortunate turn occurring in the healthcare industry. Traditional Chinese medicine is made up of 4 components: acupuncture, herbal formulas, massage, and Qi-Gong, which is an exercise therapy for self-healing as well as an energy healing method. We'll be exploring how Chinese medicine is integrating with the Western world, its ancient roots, the philosophy of Qi, and the healing benefits.
In the West, a new health discovery is being made in modern times. It is the discovery of the hidden health secrets of the Orient. For hundreds of centuries, such health secrets have remained in the hands of a select few royal physicians and healers in the West. However, traditional Chinese medicine is now becoming increasingly popular throughout the Western world, providing an indispensable complement to modern medicine. Nearly all methods of Chinese medicine are based on the one basic idea: to heal the cause first and the symptoms second. This is the foundation of Chinese healing and has been adhered to for hundreds of centuries using only all-natural programs, which may include fasting, corrective eating, acupressure, acupuncture, healing massage, herbal potions and tonics, special rejuvenation plants and foods, and simple breathing exercises. For thousands of years, Orientals have been using their all-natural healing methods with remarkable results in a great number of common ailments. The Orientals have adhered to the golden rule of health, which states that the body must maintain healthy harmony in order to enjoy perpetual youth and health. Should any dis-ease occur, Oriental healers immediately aim to restore balance, correct disruption, and use all-natural methods to help bring about harmonious healing.
Every patient, even they don't talk about it, they come here, they don't talk about the emotion side. I need to ask to find out how their lifestyle, how their working environment, everything, to figure out, how much stress, emotion, tension, in the body, yeah. And in somehow we say we should first give the herb to relax the people, to calm down, balance them. Then the treatment start working. Otherwise, they keep taking the herbs. Can be useless, if the emotion is still very uptight. So I guess another very important thing is exercise. I tell them to have to follow lots of Chinese, medicine exercise like Qi-Gong, Tai Chi, yeah, breathing exercise, meditation, yeah.
Ancient Oriental healers believe that there is a constant struggle in the body comparable to the same forces in nature. The fluctuations of these two forces, known as yin and yang, are said to influence universal energy and regulate the body's youth and health. Oriental healers follow the basic principles of folk medicine by treating the cause and not just the symptom. By correcting imbalances, the yin and yang forces are said to be in harmony and thereby allow the cause to be eliminated and the symptoms to subside. Yin signifies acid secretions in the digestive system and the expansion of its functions. It is considered to be passive, cool and dark, and dominates the liver, heart, spleen, lungs and kidneys. Yang signifies alkaline secretions in the digestive system and is considered to be more active, healing, warm, bright and independent. Yang dominates the bowel, gallbladder, stomach and bladder. Like Western doctors, traditional Oriental practitioners commence every session by trying to identify a particular patient's problem. However, Eastern practitioners rely on a completely different method of diagnosis. In Oriental medicine, good health is viewed as a state of harmony between yin and yang, which constantly change in the body, affecting the body's own energy, or Qi. Qi is said to flow along an invisible network of pathways called meridians, which link all bodily organs and systems. Any blockages or imbalances in the network are believed to cause physical or mental illness. The purpose of an Oriental diagnosis is to identify any trouble spots so that appropriate treatment can be given.
When we treat a patient, there are 4 procedures of the diagnosis. First of all, when the patient come to the clinic, we'll observe the patient appearance, include body figure, complexion, the color skin, hair, teeth, any whole body, anything. And then we have look at the patient's spirit, the body activities, which is called Shen, Chinese medicine, And that's first of all. And then I would like the patient to sit down during the talking while listening the patient voice to feel that people is quite a strong constitution or very weak constitution. And then we have to, in some way, we have to try to smell the patient body odor to find out if that patient has lots of toxins in the body. Of course, these days we don't do too much. Traditionally, using a lot, just a little bit, use hand wave to help, little bit smell, or the people, the breath, is a bad breath or anything like that. So Chinese medicine very strong connect with, we gotta touch people, very strong connected to patient, You can't just sit here, keep a long distance, no. Just ask a few questions, no. And then we have to look at the people, look at their eyes, their tongue, the tongue diagnosis, that's a past of very important diagnosis. Later I'm going to talk about the post-diagnosis as well. So from the tongue of the patient, we have to figure out what's the disease cause, what's the root of the problems. So different part of the tongue shows different parts of the body condition, constitutions. Then we're going to ask people questions about the disease history. So we're listening and ask a few associated questions to do with the disease. Finalize is most important, is a post-diagnosis. Usually we'll take for a couple minutes, 3 minutes, 5 minutes to try to feel, to listen the pulse. The way we diagnose it, when we take the pulse to feel the pulse, it's very different than Western medicine. From the pulse, we'll feel each side of the pulse indicates about each part of body condition. Chinese medicine always look at the yin and yang condition, So the left-hand side pulse indicates the yin side. The yin condition is about the deep level of energy. It is associated with body blood, body immune system, metabolism, all the deep level of the energy. And from the left hand side, and I'll try to feel the heart, liver, and the kidney energy. And this, when I take a pulse, I have to feel 3 levels: surface level, medium level, deep level. And with the right hand side, I try to feel the superficial parts of the body energy, which is called yang energy. There, I try to feel the body lung, spleen, and the surface kidney, which is called kidney yang energy. But not only I try to feel those organ energy. Through the organ, I have to try to find the partner organ, because each organ has a partnership with another organ. For example, when I try to feel people heart pulse, I have to try to figure out how's this patient's small intestine, how they work together, how's the body meridian energy flows. Through the liver, I have to try to feel the gallbladder energy. From the lung, I have to try to find the large intestine condition. So it's very, very complicated. Total, there are 27 type of different pulses. Usually we do maybe about 12 type of pulse. Yeah. So very thorough diagnosis depending on my pulse. Sometimes I don't have to remember or try to follow what patient say. I have to really total leave to my own diagnosis, because look at the condition is the root of the problems. I don't treat the disease. Yeah, that's the Chinese medicine. Holistic approach, holistic treatment, and yin-yang philosophy, and the differentiation and the diagnosis. For example, people come to see me, yes, stomach ache, stomach pain. Then I'm going to, after look at the people, check the tongue, everything, listen the history, I'm going to check the pulse. Is there any other organ tense, weak, tight? And most of the cases, stomach problem, but the liver pulse very tense, very tight. Because the root of the problem in the liver, so emotional. People get so stressed and they don't eat properly. They can eat bad food or emotionally very, like emotional stagnation plus eating food, so hurt the stomach, yeah. And through the Chinese medicine 5 elements, we have to keep figure out. Like when I say patient has liver problems, then next I have to think about the liver problem very easily attack spleen, stomach. So I quickly have to give things to protect the spleen, stomach, yeah, or the other way around, yeah.
They first you look at the whole body foundation, the whole body condition, and then they will consider the symptom relate to which part of the body. And then when you treat the symptom, at the same time also to balance the whole body functions as well.
And I guess you do this by diagnosis of the pulse?
Yeah, by diagnosis of the pulse, to look at the tongue and the face, and also ask some different questions to get all the information.
In tongue diagnosis, practitioners examine the colour, shape, coating, surface markings, moistness, dryness, cracks, scars, or ulcers on the surface of the tongue. Different parts of the tongue are examined to provide information about specific organs. For instance, a bluish-purple tip is said to show a particular energy state in the heart, and teeth marks around the edge may indicate digestive problems. Besides the yin and yang forces, Oriental medicine also uses the theory of the 5 elements of fire, wood, earth, water, and metal. Each organ in the body corresponds to a specific element, including the yin organs such as the large intestine, the gallbladder, the stomach, the bladder, and the small intestine. and the yang organs such as the lungs, the liver, the spleen and pancreas, the kidneys, and the heart. The yin organs are coupled with the yang organs and execute the same work in a complementary fashion. For instance, the liver extracts excess yin from the blood and transforms it into bile, which is stored in the gallbladder and used for emulsifying fats. If the blood is too yin, this bile will also become yin. There the elements which it contains will become frozen and may precipitate the formation of gallstones. Oriental practitioners also use herbs and spices to balance the yin and yang energies within the body. The practice of Oriental herbal medicine dates back to the very earliest periods of Chinese history. Today, more than half the population of China uses more than 1,500 different herbs, plus over 1,000 patent herbal remedies as medicines. Chinese herbalists typically use one principal herb or root and at least 3 or more assistant herbs, roots, or other natural substances in producing a remedy. However, there are instances when less is used, and in some cases a domestic remedy may consist of only one substance.
After I give a thorough diagnosis, then usually I'll decide a method of treatment. For example, we're going to I found out this patient is too much toxins. In Chinese term, maybe we call damn heat in the body. So I decided going to give cleansing herbs through whole body system. Yeah. Intestine, urinary bladder, kidney, liver, I'm going to put cleansing herbs. Then I'm going to decide herbs. How many herbs we study? Thousands of herbs. Usually we use about 400 or 500 herbs in common. Yeah. So I have to decide my prescription. It's not only one herb to fix this people problem. It's a combination of the formula. Each herb has different flavors and has different tendency, has different nature. Basically, we talk about 5 flavors of each herbs. Okay, for example, it's a sour, bitter, sweet, pungent, and savory. And also have different of the nature of the herbs, like cold, cool, warm, hot. And the tendency of the movement. Some herbs ascending, some herbs descending, some herbs upward, some herbs downward, some herbs inward, some herbs outwards. So, and each herb has a different tendency to go into which meridian in the body. Has 12, 14 meridians. So according to the patient condition, we're going to choose the herbs going to which parts of the body, which flavor we're going to use, which tendency of the movement we use. Yeah. And after I set up my prescription, and then to explain patient to take a course of the herbs. Maybe the beginning tell them take once a, say beginning I say patient once a week. After 1 week, they come back, I'll check them. They're going to take herbs 2 cups a day, morning and night. Of course, according to some individual conditions, some people I tell them only take 1 cup a day, 1 packet for 2 days. So they just basically boil the Chinese herbs in a clay pot. And I'll usually to tell people I print all of these information. They'll follow the information, how to drink the herbs, how to do the details. And also I'll talk about the diet as well. Yeah. Like when they're taking herbs, they're not allowed to drink too much coffee and alcohol. It's really bad combination. Yeah. And according to the individual condition, some people maybe like dairy food, some people maybe like spicy food, some people maybe can't have raw food, and some people maybe can't eat sweets, yeah, chocolates, this kind of thing. Then I'll write down the special diet for each case, each people. Yeah. Then they just go home to do all of this. We come back next week, I check them. Yeah, I see patient after, a few weeks, and then we'll make a plan. Maybe they just ease off the herbs. Maybe they just continue take for a few months, but I don't need to check them regularly. Yeah. There's a herbal tea, there's a tablets, there's external herbs to use, to wash, to douche, to put in the bath. All total depends the individual condition. Yeah. Original Chinese herbs really come from the people, from ordinary people, discovered by testing the herbs. Some people, early stage, they died, got killed themselves, because some herbs has strong poisoning. You need a special combination, and need a special way to boil them, to take them, And very important, this was, we say we need a knowledge prescription, So through the thousand years, Chinese, herbs just passed by generation to generation. So come by all stage, we all had a university medical Chinese medicine training. So we use the herbs very secure. It's really reassured.
In Chinese herbalism, although remedies are usually given in combinations or formulas, some single herbs may be used for many common ailments, including sweet basil, cinnamon bark, garlic, clove, fresh ginger, coriander or Chinese parsley, peppermint, ginseng, and licorice.
She came to see me the first time is March 1992. That time she was pregnant. That time she was with a 6.5 weeks pregnancy. She had an unexplained infertility condition for a number of years. She had lots of emotional stress in her life and 2 miscarriages. Since then, she couldn't get pregnant. So she had to go through this hospital fertility program, called IVF. And on her fourth IVF treatment, she got pregnant 6 weeks. But then on her 6 weeks, she started bleeding, spotting. So that time she heard about me. She come to see me for the first visits. When I checked her for the first time. Her pulse was really, really shocking, echo, because it's really weak kidney energy. So what's a kidney energy to do with the pregnancy? That kidney indicates body reproductive energy, very important, and deep body energy. So I couldn't put any stop bleeding herbs, of course. I only way to treat is just secure his kidney energy, build up his deep energy. Because her condition with pregnancy, we only have to choose a certain stage of the herb, certain amount of the herbs for pregnant woman. And after weeks, months, she's on the herbs and stopped the bleeding completely, and we saved the baby. She had the baby really healthy, but all the time she'd been taking the herbs. And after had a baby, she come to see me for general well-being, keep up her health. And then we had she had a second pregnancy, just through the tonic herbs, And now both of them, all look very well, So I'm pretty happy for, her condition, But I have to really say, like she really followed what I tell her on the herbs and the diet, Actually, my opinion is once people getting healthy, you don't have to taking the herbs, Chinese herbs all the time. You just take, every now and then to keep balance, like a maintenance, keep up the body health,
And I had been speaking to a friend of mine who's an acupuncturist, and she said to me, well, look, I know someone who's really good, and she's does Chinese herbs, and she can help you more than just bed rest. And so I thought, well, I've got nothing to lose, And I gave my friend a ring, and she gave me Lily's number, and I came to see Lily like a day or two later after the bleeding had started. And within a few days, the bleeding had stopped. And Lily was a great support, not only through her herbs working, but also emotionally. I needed that support, I think, from somebody, which I don't think traditional medicine really offers. And you know, and I managed to have a wonderful little boy at 8 months later or whatever, and 9 pounds. And then only 18 months later, I fell pregnant naturally, which was totally unexpected, with our second child, who was born 3 months ago.
The ancient art of acupuncture, spanning more than 5,000 years, has become the standard form of treatment in many parts of China. Acupuncturists use the light insertion of needles into the flesh at specific points, corresponding to the meridians which flow through the body. The prick of a needle along these zones is said to send electric impulses of energy to allow a freeing up or release of energy along that zone. By selecting specific points determined by Oriental diagnosis, acupuncture can treat many ailments such as migraines, ulcers, digestive problems, arthritis, sciatica, psoriasis, anxiety, and depression, among others. Acupuncture needles are not painful, however, may provoke a hot, cold, or a tingling sensation along a specific meridian point.
The Chinese medicine, we consider there are about 14 mind meridian in the human body. In this meridian, in the meridian, there are different points, and different points have different function related to the different organs. So, for different conditions of disease, you select different points to balance the energy and to strengthen the body functions. For example, the stomach 36 in the leg, in the area. So this point can strengthen the spleen and stomach function. It means it can strengthen the energy and blood functions. When you put the needle in, you also have different technique. The technique just to help to relieve the pain. The pain usually caused is when you insert the needle in this very short period of time. After the needle passes the skin, the pain is not much painful. So the technique is skill enough. They will be related to the pain. The pain. If you have the good technique, and then you help to reduce the pain when you insert the needle. But after you insert the needle, and also use different technique to balance the body. You can use the reducing technique if the condition is excess, or if you feel the energy is excess, or you can use reinforcing technique when the disease condition is deficiency, or when you feel the energy is deficiency, or you can use the even technique. Different type of needles was used according to the location of the point. For example, if the point in the hand is not much muscle, so you use short needle. And if in the bottom, that muscle is quite thick, so you use the long needles.
And it's not painful to do the acupuncture?
I think they have a bit, if you say it's not painful, that's not true. You will feel a bit aching sensation, or you feel a little bit sore, just like the mosquito bite. When the needle in, or when you do the manipulation. But it's not, you feel painful, it's not every point. Maybe some point you feel, some points no.
Acupuncturists may also use moxibustion, where specific acupuncture needles are heated with particular herbs to stimulate the energy on that meridian. In acupuncture therapy, cupping may also be used. In cupping, round glass clear cups are used which are positioned either on a meridian point or over an acupuncture needle, which may enable the energy on that point to be drawn up or released.
The cupping therapy may have the function is remove the energy and blood and improve the circulation and also help to relieve the pain. So for this case is caused by stagnation of energy and blood and attacked by the wind. So cupping also can help to move the energy and blood and clean the wind or clean the cold.
Food and diet are also an important part of Oriental medicine. There are 10 steps in Oriental medicine which use different foods to balance harmony within the body and allow health to occur. In a cold or yin climate, more grains, vegetables, fish and desired meat shall be eaten. In a warm yang climate, more fruits, vegetables and less fish or meat shall be eaten. Food should be as natural as possible in order to maintain the delicate yin-yang balance in food. If tempted to eat foods that are too spicy, mild foods should also be eaten to balance the delicate yin-yang balance. Food should also be familiar with climate and environment. Unnatural beverages should be minimized or avoided. Meats and fish should be organic. Those with digestive problems may need to avoid excess water intake, chew food slowly, and eating should be regular. In Oriental medicine, foods are classified as either being yin or yang. Yin foods include trout, cucumbers, beans, potatoes, oranges, bananas, butter, garlic, yogurt, and honey, among others. Yang foods include sardines, salmon, dandelion root, carrots, onions, apples, and strawberries, among others. Another form of traditional Chinese medicine is called Qi-Gong energy balancing. Qi-Gong energy balancing incorporates the use of Qi energy to rebalance the yin and yang energies within the body. A practitioner practicing Qi-Gong energy balancing builds up Qi energy in the hands and through specific placements on the body, allowing this energy to be transmitted to his or her recipient.
Qi-Gong energy balancing, as I do it, it's a massage of the body's energy field, working on the meridians, pressure points. The nature of that technique is that the way we move our hand through that process, when you can feel it, you feel it moves in a circular motion and with a heavy and light touch on every part of the body that we work through. And that regulates what we call the yin-yang, or the two polarities of all of the systems. So it balances the energy flow. It requires me as a practitioner to be very involved to the point where I have to practice certain exercises that develops the qi flow in my body, opens the channels and meridians so that my energy field is as harmonious as that can possibly be, and more powerful, hopefully, than the person I'm working on. That doesn't mean that I'm going to take control of their energy field, but because mine is in harmony, or in a greater state of harmony and strength, then I feel their field. So when I have those breaks and I put my hands on them at certain areas, what I'm doing is I'm balancing the energy in their body between my two hands. And also, when I just take that moment, what happens is I get a feeling, or I perceive what's going on in that person's body, to a point where with some people I will get a pain, or I will actually get a physical sensation in my body, And from that, I will understand more about what's happening for them. The origins of this technique, the technique itself, are not that old, because this particular technique was actually developed in Shanghai over the last 20 to 30 years. But the origins of Qi-Gong as a form of healing date back to 3,000 years ago. And there's many different varieties.
Okay, what are the different styles of Qi-Gong, you're saying?
Different styles of Qi-Gong healing, yes. And this one, I guess, is one that's very accepted in the West, because you're actually making physical contact with your patient. Many of them, and many that I've experienced in China, the practitioner and the patient could be a metre apart or 5 metres apart, and the practitioner directs his or her qi to their patient. And what's extraordinary is that when the qi flow is very powerful, the patient actually moves and responds. It's a very, very different method. Julia's main condition, or how she presented, was her menstrual cycle does give her a little bit of trouble. It's nothing really major, but it comes out more as an emotional imbalance. I checked her pulses to start the session and noticed from that her kidney energy and her spleen energy, or what we call kidney and spleen energies, were somewhat low, and that the liver energy was moderately tight, or not flowing smoothly. Her cycle, her bleeding has just finished, and so it's quite common for that situation to arise. Her tongue confirmed that. It showed me a blood energy deficiency relating to the liver, which would automatically cause the liver energy to create that stagnation or lack of flow. So with working on her, I did a very general treatment on her, really, because she didn't have a major particular physical area of problem. So working on the back, starting by working on the back with her is a fairly common thing to do, working down the bladder meridian. What I noticed immediately was the difference between the right and the left side, in that the right side was very much tighter than the left. And in many ways, I think the feedback I got from her too was that the points on the right side of her body were generally tighter and more painful than those on the left, which implies that it could be a little bit more connected to what we would call a kidney yang deficiency state. I did check that out with her at one point, and the most common way that would manifest is feeling cold or chilled. And yes, her feet have been cold of late, and that's really sufficient to know that there is that imbalance. So I worked on releasing points on the liver meridian to free up the liver energy, and I stimulated a lot of points on the kidney meridian, particularly on the soles of her feet. And she reacted on the right one most obviously, that it was quite a bit more tender than the left. And in general, I mean, the rest of the session was just regulating and harmonising that flow. Working a lot on her head, because the gallbladder meridian, which is connected to the liver meridian, is quite dominant at the head, and she does have a tendency to suffer from headaches and neck and shoulder tension. She's an entertainer, and she needs to be on show, and that in itself can create a lot of tension in a person's body. So it helps to release and let that energy flow.
You're also doing this?
Yes, I was flicking the energy a lot. or not a lot, but reasonable amount of times, because I actually feel the build-up. It's a bit like static, I suppose. You move the energy, and you don't want to leave it in the soles of their feet or at the top of the head. And I certainly don't want it in my hands either. So you take it off, and flicking the hands is a very ordinary way, really, of just getting rid of that energy.
I had a random infertility couple come to see me. Husband has a very low sperm. So we spent a few months on the herbs, roughly about 4 or 5 months on the herb to build up husband's sperm. Then 5 times got better. Then, but they still went on the program, the IVF program, because the number still not enough, and they are really hurried because their age already old. The lady is nearly 40 years old, so they want to 40 years old, so they have to be quick, So they went on IVF program, and then they got a fertilized egg first time in their old treatment. They got 6 fertilized eggs, so they put back 3 eggs. Then after, when we're waiting, must be get success. We're waiting for the good news. But after a couple of weeks later, this lady, come to tell me she had a period. She just tell me she had 2 days bleeding, no success. Then I took her pulse. The pulse very slippery and fast. In Chinese medicine, depends also, her pulse is slippery and fast in the kidney area. That's called reproductive energy. So for me, I straight away call, that's pregnant. In Chinese medicine, that's pregnant pulse. So I told her, you're very good, you're pregnant. I strong believe. She said, no, I had a 2-day bleeding. Then I started to say, what's it look like you're bleeding? Is it purple bleeding or just spotting? She said, oh, just a light spotting. I said, might not period. It's not period. She actually come to see me, want to have some period cleansing herbs. After period cleansing herbs, then I couldn't give her those kind of herbs. Will be dangerous for her if she pregnant. You see how important Chinese medicine diagnosis. So I only give her a nourishing, holding herbs, keep the pregnancy. That's from my feeling. I just a strong thought that she's pregnant. Then she ran me back next day, had a blood test. She said, I'm right. So like this kind of thing happen all the time at my work, yeah.
I had a lady yesterday actually who has low back problems, and curiously enough she has also got a kidney stone, and it's not considered to be big enough to be a problem, so the doctors don't worry about doing anything with it. But she came just for a balancing. She didn't really know that I could help her in any other way. When I linked her low back and leg problem with the kidney area, that's when she began to talk about the kidney stone. After the massage, I mean, she wasn't debilitated, but when she got off the table, it was like her legs and her back that had otherwise been creaky were really free and much less, giving her much less discomfort.
There are numerous precautions in the practice of Oriental medicine. Chinese herbalists use specific combinations and dosages of herbs, which when used incorrectly may in fact aggravate the very symptoms they were meant to eliminate.
For Chinese herbs, I mean, even like some simple herbal tea, you need a clear direction, direct from the herbalist, from the Chinese doctor, absolutely, This is what we say. We really not treat as symptoms. It's a whole body system, But most of the herbs we use, if you had a full trained about Chinese medicine, you won't go wrong,
In acupuncture, incorrectly placed points may actually provoke symptoms or ailments to increase in severity. Needles inserted too deeply into the skin may also puncture vital organs. It is important, therefore, to seek the advice of an experienced acupuncturist before attempting acupuncture.
if first you need to diagnose it's correct, and then you use the correct pawn, because different pawn have different function. So if you choose the wrong pawn, they will make the disease get worse or not effect. Or if you choose the wrong needle, or choose the wrong position, locations, and you don't know how far you're going in, you will be damage the internal organ or damage the nerve.
Obviously, we need to keep ourselves in a good state of health and harmony, which is really true of any healthcare practitioner, I would think, because of the nature of this one being so energy focused. It is important that we keep our strength and our energy up. The only other real precaution really concerns the person that you're working on, and certainly whilst most conditions will respond favourably to this technique, you have to there are certain points that you need to avoid or areas that you need to be careful of. If, for example, you're working with a pregnant woman, if you're working with somebody who's just had an operation, or if a person's had got a major bruise because they've had some trauma, you obviously just don't go barreling into that area. You work around those things. With people that have heart conditions, high blood pressure, known to have tumours and growths, you have to be very, very careful, as most practitioners do. That's not to say you can't treat them, though. You have to be very aware, and you have to know very much what it is you're doing.
Western medical view of Chinese medicine, I think these days they're getting better and better, more and more believe Chinese medicine. I came to Australia 6 years ago. When I came here, I didn't feel Chinese herbs was really popular. But through the years grew up very fast. Yeah, like I give lots of lecture to a Western doctor, to physiotherapist, and by now my work connect with few Western medical doctor and even specialists. I work with some gynecologist and some GP, yeah, and we refer patient each other, have check up, yeah, or they send to me, after they find out the people condition, they send the patient to here for general tonic build up, yeah. Because a lot of disease, Western medicine still hasn't found out the method of the treatment or the medication. But the Chinese medicine, we have different way to diagnose it, because we look at the holistic, it's a holistic way to look at the people. Of course, yeah, we always have herbs to balance it, yeah.
I would imagine that it would be something along the lines of, well, it's probably good to go and have a good massage, but don't expect to, have... Well, I'm sure that they would see it as beneficial for muscular problems, as I think they do think massage is quite useful. But in terms of it being a therapy or a form of treatment for more internal problems, such as premenstrual syndrome or emotional problems or stomach problems, I imagine, I don't know this for sure, but I imagine that they would say it won't do you any harm, but it's not going to do you much good. That's what my feeling is. I see it going quite a long way. I think that it's really in the West, it's in its infancy. My personal experience is that many people that come to me are totally disheartened with many other forms of therapy, and I'm not just talking about allopathic medicine, even many other forms of natural therapy, are not relating or not getting people over a particular barrier. Because Chinese medicine is totally holistic, in other words, physical, mental, emotional, spiritual, there is no disconnection between any of those. So every area of one's life is affected in illness and in health. And I see that we are moving more in that direction.
I'm really watching Chinese medicine growing and growing, not just because of my business is very good. Now I look at all over, the world. Yeah, I mean in America, England, Europe. My patients come from everywhere, all over the world. Yeah, bring to me the news, yeah. Tell me how Chinese medicine, worked. And yeah.
Maybe a combination of both will be the...
Western medicine, Chinese medicine, for sure, certainly, yeah. I believe to have a Western medicine checkup, like a blood test, all of this modern medical instrument checkup, really is really necessary, yeah. But maybe the method of treatment to look at the Chinese medicine, yeah, it's good, it's really good, yeah. And certain type of Western medicine, it's all right to use a short period of time, yeah, for emergency acute condition.
Today, traditional Chinese medicine is becoming widely accepted in many countries throughout the West. In Europe alone, there are well over 5,000 certified acupuncturists. In the Western world, Oriental medicine is providing a complementary holistic approach to modern medicine, encompassing thousands of years of complex experimentation, philosophy, and knowledge.